Nationwide, states are seeing a major nursing shortage across the board, and Connecticut is no different.
With more nurses retiring from the field, removing barriers have been a top priority for state leaders, but new loan borrowing rules could make access to education harder.
News 8's Caroline LaCour is here now with the latest on that. Caroline.
And Dennis, good evening. Yeah, here in Connecticut, 3,000 unfilled nursing positions are left every year, often from those leaving the industry. Now, a new policy introduced has some worried about barriers it might bring to fill those gaps.
It's causing a lot of staff burnout when it comes to nursing. So
registered nurse Keisha Gartman has experienced Connecticut's nursing shortage firsthand, clocking in overtime and covering unfilled shifts.
With this bill that's coming out, would definitely put a bigger dent into that, and that's not what we want. It's already bleeding.
She's talking about new federal regulations through the One Big Beautiful Bill Act that caps student loan borrowing for nursing students, and it's raising concerns for what the policy means for those trying to break into the field.
Nobody can expect nurses to enroll in these programs when the resources aren't available for them to afford going through them.
Graduate students will only be able to borrow up to $100,000 in federal student loans after the Department of Education removed nursing from its list of professional degree programs. Some say it's a slap in the face.
These fields deserve to be recognized and are essential professionals for our healthcare system.
But those with the Department of Education say the reclassification does not speak to the job's importance. A spokesperson with the Trump administration noting fiscal responsibility is a top priority for the Trump administration, which is why the One Big Beautiful Bill Act put common sense caps on federal loans for graduate programs, driving down bloated tuition costs and helping reduce student loan debt. Press Secretary for Higher Education Ellen Keast adding, according to department data, 95% of nursing students are studying in programs that won't be affected by the new caps. As for the most expensive outlying 5%, enrolled students are grandfathered into current lending limits to ensure there are no barriers to completion.
When I graduated, I had more than $127,000 in a student loan debt.
Those loans making Gartman's dream career possible. Now she's worried others might not be able to do the same.
It felt very disheartening, and so I had.
The Department of Education still has to publish a final rule defining professional student tracks and says it may make changes based on public comments. And Dennis?